of national unity. And I'm David Cote. I'm privileged today to have some very important guests in studio from the Trinity Dental Clinic, located at the ELWA hospital. I'm particularly happy today because I have in studio Dr. Stretton-Downes. I have been praying to get him here, but because of his very busy schedule, it's been a little difficult. He has always sent Mr. ELWA, who has also done very well here on all of the shows. It's a privilege to have you today, sir.
Thank you.
For taking time off your busy schedule. Even though today is a holiday, but you are here. Thank you.
It's a pleasure to be here, David. Thank you for having me.
Thank you. Dr. Stretton-Downes is my guest today, together with ELWA, who has always been here. Dr. Summers is a qualified dentist who has practiced for more than 40 years. That's not a small time. 40 years. First, he came to Liberia in 2016 to do some observation to see how he could fit in the system. And then he later came back in 2017. And since then, he's been here doing very well. And those of us who have been to the Trinity Dental Clinic know what we're talking about. I have testified here before. I'm going to do it again. Now, our main concern here today would be the project. He's doing some school project here, dental school project, and now he's going to tell you about it and tell you about his experience recently in a place called Harper, Maryland County, and so on. And we'll have Mr. ELWA telling us about some of the other things we do there, that they do there. Well, thank you. Dr. Stretton-Downes, I see opposite. Please introduce yourself a little bit. Who want to know you?
Okay.
Yeah.
Yes, I've been a qualified dentist since 1983, and I have worked in a number of places, including Ethiopia, for 8 years, and then also in the UK for over 20 years, and now in Liberia for over 7 years.
That sounds good. Now, in your, I see here, I wrote down something here, and I see here, OBE. Now, what is this OBE? I'm hearing that the Queen of England honored you.
This is true. Yes, I was honoured by the Queen in her birthday honours list in the summer of 2021 with an OBE, which stands for Officer of the Order of the British Empire, which is an award which was given to me for services to dentistry in Africa, and in particular in Liberia. And I went to Windsor Castle in May 2022, and I received my medal from Prince Charles, as he was then.
This is wonderful. I'm so glad to hear that. You know, sometimes when these honors are given, we don't care to know whether money accompany it. No, that's not the issue. No, money, no. The fact that the Queen of England honored you for your services,
sure,
that's enough. It's more than $2 or $10 billion.
Absolutely.
Let me say congratulations.
Thank you.
Mr. ELWA, please say a little bit about yourself, even though you have done it. You know, every time we have new listeners, and you need to say it again. And let me inform you, when you came the first 2 times or the first 2 days, when you came, we didn't have the Facebook page. Now we have Facebook attached now to this whole process. I'm proud to inform you. Can go to your Facebook and see what I'm talking about. We have 5,300 followers now on Facebook, on my personal page. And then we also have you on Flashpoint page. So it's going very well all over. We hope that your people out there are going to be watching. Thank you. So tell me a little bit about yourself.
Okay, Mr. ELWA is the son of Dr. Samuel Stretton-Downes.
I like that.
So, So he made me sitting here today a reality.
I like that.
So I've been there over a few occasions now, so it's always good to be here. Today I'm here with the man of the house himself. So I mean, I look forward to what the public will have to hear about us and the different things to do now, our project, the clinic, back from the clinic, and even the dental school. And Sam has been an amazing man, so today we'll get to know more about what Dr. Sam is really doing in this country.
Then he's really a good father because you are his ambassador and you have proven to be a good son. Oh yes. I could tell from the calls that you received when you came. So for you to be proud to be a son of Dr. Summers, then I'm proud of him too. He's really got a good son with a good training. Thank you. Now let me come back to you, Dr. Summers. We just we call you Dr. Summers now.
That's absolutely
you
fine.
Downes, but let's just say Dr. Summers. Dr. Summers, tell me a little bit about the school that you are running, the school system. I saw the school, you took me around, I saw one or two of the classrooms and so on. But tell me about the school. Why are you running this school?
Well, yeah, thank you for that question. I think Archie's testimony, in a sense, is a summary of all that we have sought to do here through the school. You may not be aware of it, but there are very, very few dentists here in Liberia, probably around 7 or 8 dentists and a handful of other dental practitioners for a population of over 5.5 million people in Liberia. And there is a tremendous need for oral health and dental health education and treatment in the country. And part of the vision that we've got at Trinity Dental Clinic is to try to help meet that need in a very practical way. And Archie is a living example of how that's come about.
Yes.
When I came to Liberia, part of the reason for my coming was I was inspired by the person who was running the clinic when I came to visit, Eddie McQueen. And Eddie is a Liberian. He has a real passion for seeing the dental needs of Liberia met. And that was part of the encouragement for me to come back in 2017. And part of the vision was to send Eddie to dental school, and he's currently in his final year of training at the dental school in Nairobi, and we're looking forward to welcoming him back as a doctor very soon. And the other part of the vision was to train dental therapy practitioners, and Archie is one of our graduates from June this year, and he's followed a 2-year course which we have created in conjunction with Cuttington University here in Liberia and with our partner university, Plymouth University in the UK. And together between those 2 institutions and the work we've done here, we've created a 2-year program which leads to an associate science degree from Cuttington University, and it also leads to a licensing through the Liberia Medical Dental Council as a registered dental practitioner in Liberia. And Archie has been through that program, the 2-year program. He graduated from Cuttington in June this year, and he received his license from the LMDC. So now he is authorized, he's academically trained, and he's licensed by the government of Liberia to practice dental work in Liberia. And that is the first fruit of our program. And we currently have another 12 students in training, 6 in our second year, and a new group of 6 in our first year. So they're due to graduate over the next couple of years to expand the number of practitioners that we have. So that's our vision, and the students are given academic training, and they're also then given a lot of practical training, so that they combine the academic work with the practical service and the treatment of patients.
Now, what you're telling us today is that your ultimate dream or aim is to make sure that you have many dentists around the country.
Yes,
because there's a great need.
Absolutely. And what our vision is, the way we've tried to put our vision into practice, is instead of taking somebody, say, who lives in Painesville and bringing them to the school, graduating them, and then saying to them, oh, by the way, we want you to go and work in Harper.
That may be
so what we're trying to do is we bring people into Monrovia from the place where we want them to work. So, for example, one of our graduates, along with Archie, comes from Voinjama. And she came down to Monrovia. It was the first time she'd come to Monrovia. She did her 2-year training, and she's now back up in Voinjama as a qualified dental practitioner.
That's a wise decision.
Yeah. So we're bringing people from the place we want them to work, and then they go back home.
Yes.
To do the work that we train them to do.
I don't know how you came up with that decision, but it's a very good one, because I have seen in this country, not only in the dental area or medical area, but when people are trained in this place and asked to go back home, they hardly do it. So it's a good decision, a good plan. But when you come from Vonjama, and we train you and say go back, you'll be willing to go back.
Yes, yes. We not only train them, but we also equip them. We're working in partnership with a UK charity called Dentaid, and we've purchased from Dentaid portable dental equipment, a chair, instruments, pressure cooker for sterilising, and all our graduates have a kit, so they have all the stuff that they need to do the work that we've trained them to do.
Okay, but do you do that in collaboration with a hospital, so that when they go, they can have a space to operate from?
Yes, that is the ultimate goal.
Okay.
To do that, yes.
Okay.
So all our people who come as students, we like them to have a sponsor, so that we know where they're going to work once they qualify. So we try to see the end from the beginning, as it were.
Yeah. Before I go to Archie, let me ask you one other question. I heard about an experience you had recently in Harper, Maryland County.
This is true.
Please tell me about it.
Okay, so we were very fortunate at Mission Aviation Fellowship, MAF. They came to us last year and they said they would like to sponsor taking us by plane to more remote areas. And the trip to Harper last week was the first one of those trips. Yeah, just last week. We flew down to Harper, which, as you know, is a long two-day car journey. Yeah. But on the MAF plane, it takes 1 hour 40 minutes. We took a team of 9 people, 4 of whom were students in our school. And when we arrived in Harper on a Monday morning, there was over 90 people waiting with tooth problems.
Over 90 people waiting with tooth problems?
Yes.
In Harper?
In Harper.
Last week?
Last week. And we, over the course of 3.5 days, we worked until 7 o'clock every night. We treated over 240 patients. We extracted 635 teeth over that period of time. And even then, when we finished, we had to send away more than 40 or 50 people who we weren't able to treat. So it shows to me how big the need is in Liberia. And that is why at Trinity Dental Clinic and the Liberia Dental Therapy School, we're trying to actively do something about this problem.
Then there is a need for the school. And I'd like to say thank you.
There is no question about that.
From the experience you just gave, there is a need for the school. Yeah. Actually, let me come to you again, before I come back to Dr. Summers. Tell me about some of those things you do there. I have an experience that I'm going to talk about with Dr. Summers. First with you. I remember before Dr. Summers came back from abroad, I met with you. And I had a problem here with one of my teeth. And I said I wanted it to crack. The powder was not too good, just crack it off. He said, that's not going to work for you. You may want it that way, but it's going to give you a problem. I said, that's what I want. I did not want to see an empty space here. He said, okay, if that's what you want, that's what I will do. And you did it. After 2 weeks, I ran back to you. The pain was there, and I ran back to you. You had to say, well, I told you, and you remove it. And the big experience with Dr. Summers, I'm going to come to that, the root canal process of treatment. I'll come to that. But tell the public, what are some of those things you do there? Somebody who's listening now may want to come to, may have a problem and they don't know where to go. So what are some of those things you do there?
Okay, at our dental clinic, we do teeth extraction. All right, so that means people who get bad teeth and molar already hurting, we can take it off for you. Then we don't also take out teeth, we also do teeth fixing, what we call filling. I mean, when you got the teeth and the hole just started, now when the hole already not made your jaw swell.
Just turn to the mic a little bit.
So when the hole is just starting, it's best you come to us. We can also clean that area and fill it for you. Then some of the people who we have also taken on, I want to do replacement, want to put some teeth back. We'll also do replacement. We'll do a partial denture. All right, we replace your missing teeth. We also do when you talk about the procedure on the root canal.
The root canal, yeah.
Yeah. So yeah, and that one is when you have the tooth, the hole is already there and it's giving you that pain, but the tooth is still strong to go. And you say, okay, yeah, let's try and do something. So root canal is actually saving the tooth.
Saving it.
Yeah. So
just as you saved mine.
Yeah. So go there and take the nerve out and this. So we doing this thing, taking out teeth, filling teeth, doing replacement. We also do hygiene. People who got all the green things on their teeth, and the yellow things on the teeth, we can also clean it. So if you're out there listening to us, you can come to the clinic, the Trinity Dental Clinic. We can clean that thing for you and give your mouth a fresh feeling again.
Yeah.
We can do that. So we're doing these different things every day from Monday to Friday. Before Dr. Simon came, we had them on schedule. Okay, there were specific days we used to do because we had low staff, low equipment and things like that until when he came. So he had to transform it. So now the clinic is running from Monday to Friday, every day, doing everything we mentioned here. Cleaning teeth, filling teeth, replacing teeth, taking out teeth every day. Okay. And a lot of things. People come in with a lot of big huge swellings and things, and we do wonderful things.
Yeah. And I can attest to that. At Trinity Dental Clinic, they do not only have the professional equipment, but they have the expertise. They have the equipment and they can do the job. So I advise you to go there. But if you want to get there, please call these numbers and book an appointment. 0777 911 546. I repeat, 0777 911 546 or 0886 911 546. So those are numbers you can call to book an appointment to get there. Are you very expensive?
No. We are the cheapest dental clinic in Africa. The cheapest dental clinic in Africa. We are not expensive. People can pay up to the minimum $6 to take out. $6, $12 can even. So we try to really bring out Dr. Simon. Like I always mention Dr. Simon because he's the main man there. You understand? We all just helping. But his idea is that everyone bring in a full. All right, because we already don't have much access to this thing, and there should be nothing stopping you, especially when it comes to money, from meeting the treatment. So $6, we believe. All right.
Yeah.
So we are the cheapest so far.
And when it comes to the root canal treatment I did there, I was telling somebody who came from somewhere abroad, and when I told him what I paid, he said it was a giveaway just for nothing. You didn't pay anything, because he said to me where he did his, where he came from, some part of Europe, I think South Africa or somewhere. He said to me he paid $1,500 to do a root canal treatment. But here, I don't remember paying up to even $150. I don't remember that. So you're doing very well. Now, when it comes to cleaning the teeth, there was someone who called me and talked about cleaning the teeth. He wanted to know how much to do that. But you will explain to me, Dr. Summers, a little bit about this whole root canal process. That's not why I called you today. But please just talk about it a little bit, because I'm so happy that I'm free today. Yes, because I did not know how bad it was until you did the x-ray. I went somewhere else and nobody talked about x-ray. No. But you said before we can do this thing, first, this tooth was longer than the others. And you straightened it. This time I can smile openly now. I'm so happy. Apart from that, I did not know the problems in there until the x-ray was done. And it was there I said to you, sir, thank you, and I have to do this treatment. So please tell the public a little bit. We're not going to go too much in that today. I called you mainly today to talk about your plan to train people to go back home to help their people. That's why I called you today. Well, please talk a little bit about this root canal business.
Okay, yeah. I mean, a root canal is a process where you clean out the nerve or the flesh that is inside the middle of every tooth. And this can be damaged either from decay, if the tooth has a hole in it, or it can also be damaged, as in your case, through trauma, where the tooth is hit.
Yes.
And this can damage the blood supply to the nerve and make it die, even though there is no hole in the tooth. So if the tooth is strong and there's enough tooth to save, it is possible to clean out the nerve canal and put a filling inside the middle of the tooth.
That's what you did.
That's what a root canal filling is. Yeah.
That's what you did for me. Now, Ajay, talk about the calculus a little bit. I invited Dr. Summers yesterday to talk about the school. I'm going to go back to him. But tell me about the calculus, or the particles between the teeth. Why is it important for a cleanup? Why do you think it is important for people to go and clean their teeth at your place or anywhere?
The calculus there is very, very dangerous to be on your teeth. They represent bacteria that can eat the bone from around the teeth and leave the teeth vulnerable. We've seen cases where the calculus will really get stuck to the teeth, and when you take care of the teeth, just be flipping. They're very bad. And so that's why we have the beautiful equipment to clean it. Because when you have it, use the toothbrush, Western toothbrush, they can take it out. Yeah. So, and you don't have to stress yourself maybe going through all that because you have, these things on your teeth. They are not good. They first start with, the small food you eat, the stain, food stain stay there on your teeth. And some people don't do proper brushing. We talked about it before. You're supposed to brush 2 times a day, morning and night. When you brush at night, you make sure you have no meal again. You just spit the paste out and then you go to bed. But a lot of people don't do it. So you see these things build on the teeth and there, and some of them can even take past strip up to strip that thing from on the teeth. It's just not good. So the calcula is very, very, very. These are bacteria that go around the teeth, like I said, and eat the bone to leave the teeth vulnerable. The teeth, the reason the teeth strong in our mouth because they have bone supporting them. So when the bone is no more around the teeth, they will flip.
Tell me a little bit about toothache. This is one of the major problems in this country. Toothache. What are the causes and what can be done about it? Can you handle toothache also?
Yes, we can handle toothache. We'll tell it over and over here. We can handle toothache. That's what we do every day. So when you say toothache, it means tooth and it means pain. So you have the tooth, then you have pain. But then there are different things that can cause toothache. That we'll talk about here over and over. One thing is either that tooth is decayed. Yeah, so you have the tooth that has a hole, and the hole stays there. Dr. Simon mentioned it goes into the nerve. That part is responsible to send the fluid into the entire body. So the hole goes into the nerve. It can cause toothache. Another thing that can cause toothache is when you go eat chew bone, you go eat chew hard bone, then the tooth crack. So you go chew hard bone, like chew cow bone or some kind of goat bone or some kind of bone, and the tooth crack. They can also cause toothache when it reaches the nerve. It causes toothache as well. You also have some gum trouble that can cause you toothache. When you have gum pain, different things that can cause you toothache. And like I said, yeah. So trauma also, some people you go join fire, they blow you. Then they strong impact on the tooth, they crack the tooth, and when it reaches the nerve, it causes toothache.
Yeah.
Right.
We talked about it before, 1 or 2 times. The reason why we sometimes repeat these things, there are always new audiences, new listeners. There's somebody who's listening today who did not listen when you came the first 2 times. So that's why we're talking about this. We'll soon be going to the lines. We have been here for roughly 25 minutes now. We'll ask 1 or 2 more questions. When it comes to the calls, I will advise that you, when we take the break and come back to you, please call 0777 511 977. 0777 511 977 or 0886 511 977. Those are the numbers to call to participate. That's going to be after we take the break and come back. And let me say many thanks to Lucky Pharmacy. They are here supporting my program partly. This is a paid-for program. We are not here on charity. And so Lucky Pharmacy is one of those people who's helping to pay my bills here. So we're going to have a short break where we'll play the promo and we'll get back to you. But before then, Dr. Summers, I still want to come back to the school issue. Anybody who's listening to you now, especially members of the government, will be very happy. I know you're not here for politics. You don't like to preach that. But the point is, I'm surprised to hear you saying that this is your interest, to train more people. Now look at the experience you had in Harper recently. 90 persons waiting for you. And you treat a whole lot of people, and you have to send back 40 to 50 because you didn't have the time. Now, what if those places already had trained dentists? Then it would be good for them. And that's your main aim.
That is the aim, yes.
That's it.
Yes.
Now, are you discouraged, or are you really seeing some improvement in what you're trying to do? Are students really learning and willing to go back to their people?
I mean, I think the students that we've received for training, by and large, they've all been very enthusiastic. What we're looking for is to take on more students in the coming days, and each of those students needs a sponsor who is willing to support them through the program, so that they can get the training and then go back to the places where there is, as we've seen, a great deal of need.
Okay.
So yes, we're working with the Ministry of Health, with the Liberian Medical Dental Council, we're working with Cuttington University, we're working with a number of different partners to try and achieve these goals, but the needs, as we've seen, are very, very great.
Yeah. Is the response looking good? I mean, are more students coming?
There's always room for more. So, we took on 6 students just recently in October. We could have taken more students than we've actually got.
Okay.
But we were struggling to find the right people.
The right people.
Yes.
That's another thing. Not just the company, but the right people.
They don't need to have high qualifications.
That's my next question. You just answered it.
Okay, so as long as they have finished high school
good.
and they've got their West Africa certificates,
Yes.
they don't need any other qualifications.
Uh-huh.
Now, we have had some students who are nurses or have even got a degree, but that is not essential. What we're really looking for is people who have a passion to do the work that we want to train them to do.
That's a good point. That's a good point. That's very clear to emphasize. Because somebody who's listening now may say, I want to go there. But do I have to be a college graduate? No. Once you're a high school person, you can make it.
Mm-hmm.
But the interest has to be there, and you must be willing to learn.
Yes, and all the details of this, you can find them on our website, which is www.ldts, Liberia Dental Therapy School.org. And the details of how to apply and what the criteria are all on that website.
Okay. Well, thank you. You want to add something quickly before we...
Yes. So, our school, it's not like the way the other schools, can operate. For us, dentistry is not really popular yet.
Mm-hmm.
So we don't want to train you, then you take file and put it on your hand and be looking for a job around.
Mm-hmm.
Okay, so his vision is, like he said, if you are from Vanjama regional now, so
yes.
from that region,
Mm-hmm.
you come through a sponsorship.
Yes.
Right? So you come, we train you, then we give your equipment to your sponsor.
Okay.
Then your sponsor, then you go back now and then deploy you.
Okay.
So this is not a project where when you graduate from this school, you put the file on your arm and you go into
around to look for
application all around. That's not what we want.
So
that's why even taking the student intake, we gotta pass through some procedures, because it's not saying, okay, we want 200 people come in class. No. So his point is, and which is reasonable.
Yeah.
When you finish with this school, you go back and serve.
Yeah.
Not for you to graduate from the school and say, okay, I went to the school, like the other school now, I got a degree. No. You should be practicing.
Yes.
Because there's a need here.
Yeah, so that means those who will be sponsoring people must be hospitals or clinics. For example, the Vanjama, the Delaware Hospital,
yes,
is from Vanjama. So the hospital has to be the one to sponsor that person.
Not necessarily the hospital, but the person who is sponsoring you should have a link, because when you finish, you will all definitely, because we train you that you always have to work with the hospital for covering.
Okay.
All right, for covering. So you always, in some cases, you're going to refer them to the hospital.
Yeah.
Some cases, I am not able to refer them to him because he's my cover.
Yeah.
Okay. So it could be a hospital or a private clinic.
Oh, okay.
Or somewhere where there is a place to work.
A place to work. That's the major thing.
Yes.
Yes. So you can graduate and you start to find a place where you can do your dental training. Work them. I understand. Okay. You want to add something before I take a break? Okay. All right. We will now take a break, and after the break, you can call these numbers to participate. 0777-511-977 or 086-511-977. Let's take a break.